Hello and welcome to Rooted Connection, exploring intimacy through pelvic floor awareness. I am Dr. Madi, and I am looking forward to discussing these pelvic floor topics with you. Pelvic floor is very much my passion, and so I am excited to share with the world kind of what that entails. I feel like a lot of us are not very in tune with our pelvic floor, and that can also play a role in intimacy, which is what we are going to talk about today. So, many women do experience a form of disconnect from their bodies, which not only leads to intimacy issues, but also physical discomfort and emotional distance from you, your own self, and or partner. Research actually shows that 60% of women report having intimate issues due to pelvic floor dysfunction, which is a very high amount. So we first need to start by understanding what your pelvic floor is, how it works through its anatomy, and also, the female anatomy is not as complex as people make it seem. I think that the hard part is growing up, we are taught to not really taught what our bodies are truly capable of. Like sex ed only taught you do not have sex. They didn't teach you anything else. So as women, we have so much more that we should all know about our female health that will not only benefit us physically, but mentally and emotionally as well. So we're going to get started. So, pelvic floor function. There's a lot of different things that your pelvic floor does and also aids in too. Okay. So, pelvic floor function aids in abdominal support, childbirth, prevents leaking, intra-abdominal pressure is here and works with the diaphragm. And also, the big one that we're going to spend some time on today is intimacy as well. So, there are some pelvic floor dysfunction is very common. There are many different causes leading up to it as well. So that can be caused by traumatic injuries, it can be caused by pregnancy, any forms of pelvic surgery, and also stress and overuse. Just think about like all of us that are like clenching our teeth or just like clenching our butt without knowing it. That also causes a lot of stress on our body and is caused by like overuse as well. So, we're going to get into talking about that. Most women hold all of their stress and trauma in their pelvic floor, which can cause women to want to disconnect from that area for emotional reasons too. So now we're going to tap into the anatomy and physiology of the pelvic floor and kind of what that is. So, your pelvic floor is a group of muscles that line the base of your pelvis. So, these muscles are located between the pubic symphysis, your ischial tuberosities or your sit bones, and then your coccyx or your tailbone. Okay. Your pelvis is home to your reproductive organs, bladder, and your rectum. So, the your pelvic floor is going to affect the joints of your pelvis as a whole, and you can have a hypertonic or a hypotonic pelvic floor, which we're going to get into as well. So the role of the pelvic floor muscles is to support these organs and is also to part of your deep core where it works with your diaphragm to support normal breathing patterns. As we inhale, the pelvic floor and diaphragm relaxes and expands down. As we exhale, the pelvic floor and diaphragm come up to a resting position. So with this, as you take a big deep breath in, you should feel that your pelvic floor goes down and kind of into the chair that you're sitting in. As you exhale, you should feel that pelvic floor come up off the chair too. So that's what we're going to kind of also talk about too, is how that 360-degree breathing and breath work works together. So, a healthy pelvic floor will work symmetrically to contract and relax as needed. So, that can prevent leaking, assist with going to the bathroom, childbirth, and intimacy. If we have a hypertonic pelvic floor, that means our pelvic floor is going to be very tight. If we have a hypotonic pelvic floor, that means it's going to be really relaxed and not as strong, too. So the three layers to your pelvic floor are going to be your superficial perineal pouch. So you can see all these different layers here on the screen. So The deepest one is going to be through the deep perineal pouch, and then you're going to get to the pelvic diaphragm as well. If there's any imbalance or hypertonicity in the pelvic floor and surrounding muscles, it can impede the proper movement of the SI joint by pulling the sacrum or pelvis out of alignment. So, pelvic stability is key to keeping your pelvic floor from over or underworking. As we talked about, the overworking pelvic floor is going to be your hypertonic pelvic floor, and it has increased resting tone, which causes weakness over time. With that being said, you can have the opposite, like we talked about with the hypotonic pelvic floor. And this can all happen either individually to one side or both sides too of your pelvic floor. So these can be caused by injury, altered breathing patterns, chronic pressure, and stress. So if you have difficulty relaxing your pelvic floor, it can be caused by constipation, muscle guarding, pain with penetration during intimacy, and that can also lead to an underworking pelvic floor, which is referred to as the hypotonic pelvic floor. So as we can see here, we also can see kind of like deeper of like how the pelvis is going to work and those deeper core muscles too with your iliacus, and then also with your psoas muscles, which we can see through here, and your QLs as well. So your diaphragm is going to be connected to your psoas, the quadratus lumborum, and the transversus abdominis. The psoas muscle impacts the tone of the pelvic floor too, and the abdominal muscles, transverse abdominis, holds tension in the diaphragm and stabilizes the rib cage, which is what we can see over here. Okay, so back here is going to be your QL muscles, your TA, or your transversus abdominis, how that interacts with those muscles of the pelvic floor, and then your diaphragm as well. So when we're looking at your major breathing muscle, it is going to be your diaphragm. Okay, so innervation stimulates a parasympathetic response, and that's going to be your rest and digest response. Okay, so this is when it's going to get your body to kind of be in that more relaxed state, which is definitely what we want, right? So, and when we're looking at this, so you can see under here where that diaphragm is going to be up under that rib cage. So it is really important how our ribs function as a whole. So your ribs 2 through 6 should move like a pump handle, and then ribs 7 through 10 should move more like a bucket handle, expanding out wider. So those are going to be your lower ribs out here. So proper function of the ribs and the abdominal muscles is correlated to how your diaphragm is actually going to function overall. So here's a great video that I love. So it's going to show how your ribs are moving, how your lungs and your diaphragm are going to move when you take an inhale and an exhale. You can even see up through here how that's going to affect your thoracic spine or your mid-back area, but also where these accessory muscles will tend to be, like how much that deep belly breath is really going to focus on alleviating a lot of that pressure up through here. So when we're looking at your structural alignment or the spine, right? So there are a couple key things that are going to be important when we are looking at how your body is alignment wise, right? So a lot of it is going to be like posture. Do we have a lot of forward head carriage, or are we jutting that chin out far for the anterior head carriage? Your thoracic spine mobility, like we saw in that video of the breathing, how much your mid back actually plays a role in your breath work. A lot of us, that's where we hold our tension, especially like for women, like we had talked about. So a lot of us are very tight and tense. If we don't get the mobility like we need to in our thoracic spine, that is going to impede how our ribs work and impede how we are able to take those proper breaths too. Also, if we have rounded shoulders or that we're kind of collapsing in, that can play a role in how tight that those mid-back muscles are going to be and also affect alignment. We talked about the rib cage and how the different levels are supposed to move too, right? So the top are supposed to move like the pump handle, the bottom is supposed to move like a bucket handle. So making sure that those are moving in the proper ways is also going to help with the breath work, which will in turn help with your pelvic floor. Also looking at your lumbar curvature. So lumbar curve, are we nice and straight through there? Do we have a good lordosis? Are we butt clenchers, which I do like to talk about with patients? Are we clenching your butt and just holding our stability there? That's going to also impede our lordosis in our lumbar curvature. And then looking at the pelvis, right? Pelvis is going to house that pelvic floor. So, how is our positioning? How is our alignment of our pelvis? We like to talk about the luxury pelvis, making sure that everything is moving properly. So, that is a big key point as well. So, diaphragmatic breathing, also known as 360-degree breathing now. So, I love this quote: if breathing is not normalized, no other movement pattern can be, which is so true, which is what we saw with that breathing pattern of how much of our body is being used for one simple breath, right? And a lot of us now do backwards breathing. So we all breathe from our chest instead of from our bellies, which is also going to change our patterns overall. So when we're looking at diaphragmatic breathing, we really want to look into, do we have that back body expansion? Is our rib cage expanding too? So we'll talk about side lying breathing. And then, like I said, the 360-degree breathing. So we should be feeling that breath in our lower belly, through our low back, and also into our rib cage or our sides. So that's really going to create that connection with your pelvic floor. We can really get that breath deep down into our pelvic muscles, into the pelvis, and really stabilize the low back too. So with the back body expansion, I always have people, you can lay on your back. You can either have your feet up on a wall, kind of in that 90-90 position, or whatever's comfortable for you. But then you can feel, I want you to imagine like pushing that back into the floor while also pushing your belly out. That's going to get that back body expansion. I also really like having you lay on your side. You can kind of lay with your head propped up, put your side or your hands along the side of your rib cage, kind of lower one in like kind of like a C shape. And then you can take a nice big belly breath in, and you should be able to feel your belly expand, your ribs expand kind of out sideways in that bucket handle movement, and then also into the back as well. So those are kind of like my key points when teaching any 360-degree breathing or getting into that diaphragmatic breathing as well. So, how do we help your pelvic floor? This is a big one. So, making sure that we're doing that diaphragmatic breathing, 360-degree breathing. I know that's just very simple, but that is the best place to start when you're really trying to connect with that pelvic floor. Are you really pushing those breaths into your pelvis? Are you feeling your pelvic floor on that inhale really drop down? Are you feeling it on the exhale come up? And are you feeling stable within your low back? Connecting with your pelvic floor. So, really focusing on moving that breath all the way down to your body will really kind of build that intuitiveness that you would have with your pelvic floor. Making sure structurally you're nice and aligned too, right? We can see how every different area of the body really plays into how our pelvic floor functions, whether it's from your head to your toes, from that thoracic area or your mid back, from your lumbar spine, low back, and your pelvis as well. And then making sure we're checking the surrounding muscles and soft tissue, right? So we saw how many muscles play a role into your pelvic floor, not only just those deep core muscles, your pelvic floor muscles, but also how are your glutes? How's your piriformis? Making sure that even like that your quads and your adductors and your um, hamstrings, that those are all functioning properly and doing those movements that we need them to do. The glutes are actually called the window to the pelvic floor because the muscle tone of the glutes give good insight to the muscle tone of the pelvic floor as a whole. And then assessing your everyday movements for functionality. So, how are we moving day to day? Do you favor one side? If you have kiddos, do you hold kids on one side more than the other with like your hip kind of propped out? How do you sit in your car on the way to work? How are you picking up things off the floor? Are you contracting your low back? Are you weaken your low back so that most of your movement is coming from your glutes. Those are big things that we want to look at so that we can help your pelvic floor either relax or strengthen in the way that it needs to. So these are a few things that I love to get your pelvic floor to relax. So a wide legs child's pose, really making sure we get those deep breaths in through that pelvic floor too. And then same with a door squat. So you can just really feel and connect with your pelvic floor in these positions. Like, are you able to feel it relax? Do you feel it tighten? That's a key piece. These are good strengthening exercises. Glute bridges, like we said, glutes are the window to the pelvic floor. So, do we need to strengthen those? Do we need to stretch those? A hip hinge, just making sure that we're using more of that pelvis than the low back, really focusing on breath work in that area. So, I always tell people too, like, even if you're bending down to pick something up, take a nice big breath, like your 360-degree breath. Go ahead and hold, pick something up, come back up, and then relax. And that's going to help protect your low back and pelvis as well. So like we talked about, like how are you performing your daily living activities? So are you aware of your posture? How are you carrying your baby, laundry, groceries, or your purse even? Are you bracing before picking up your baby's toys, your baby, dishes, anything? And then what repetitive motions are you doing at work or at school? So now we get to the intimacy and your pelvic floor. Okay. So big thing is like, do you feel connected to your pelvic floor? Do you know, like, are you able to really feel that movement with your pelvic floor? What does your pelvic floor feel like? Do you feel like you're tight and tense? Do you feel like you have no control of your pelvic floor? And what is causing your discomfort with your pelvic floor? Is this physical? Is it emotional? Is there deeper rooted problems that we need to look at too? So, with this and the intimacy in your pelvic floor, so painful sex is called dyspareunia or inability to have sex. So, this can be due to the tone of the pelvic floor muscles. So, the pelvic floor can impact sexual arousal and the ability to achieve an orgasm. So, this again can be from either having a hypertonic pelvic floor, a hypotonic pelvic floor, vaginal dryness, and a lack of disconnect to your pelvic floor. So, a lack of arousal can lead to dryness and pain during intimacy, which can be caused by several things. Actually, birth control is a major contributor to that too, and that's a whole nother topic that we can talk about at a different time. But so, how do we keep this intimacy going? So, it's all going to come back to how connected you are with your pelvic floor. So, now that we are aware of the anatomy, techniques to help your pelvic floor either relax or strengthen, and just how important your pelvic floor is, we can start to feel empowered in our bodies for whatever we want it to do, whether it's working out or jumping on a trampoline, not peeing your pants, or supporting proper structures in your body. This is just going to help, like in the future, like with strength, with better sex, with how you're having a baby, with postpartum recovery, lots of major things too. So, I also really love pelvic floor physical therapy. We work with a lot of pelvic floor physical therapists, and I think it is amazing to go see them. And we all work together on that. So, that is a route that I always send patients as well because um, until we know truly what's going on in your pelvic floor, then we can help assess that too by helping with the alignment and structure in your body as a whole. So, if you guys do have any questions after watching this, either feel free to reach out to me in the clinic. Go ahead and send me an email. So my email is Dr. Madi, DRMADI, at impact-chiropractic.com. Or just go ahead and send a text into the girls at the front desk and say, hey, I watched your presentation on rooted in connection and have a few follow-up questions, and I would love to reach out to you and I can give you a phone call. But I hope you guys have a great day, and if this is something that interests you more and you want to go more in depth with it, I am more than willing, so just let me know. Have a great day.